The Trump administration is now using its subpoena power to go after doctors and their transgender patients. The Washington Post reports that the Justice Department is demanding that hospitals turn over sensitive information related to their young trans patients' medical care. Details like birthdays, social security numbers, home addresses. That's according to a copy of a subpoena made public in a court filing this week. One example. In June, the subpoena to the Children's Hospital of Philadelphia that, quote, requests emails, Zoom recordings, every writing or record of whatever type doctors have made, voicemails and text messages on encrypted platforms dating to January 2020, before hormone therapy, puberty blockers, and gender transition surgery had been banned anywhere in the United States. Joining me now, Jennifer Levi, GLAAD Law Senior Director of Transgender and Queer Rights. Dr. Vin Gupta is MSNBC medical contributor and global health policy expert. Jonathan Capehart is back with me. I mean, Dr. Gupta, most people go into their doctor's office with an expectation of privacy. Is that the doctor's understanding as well? And what impact could this have?
It is, Chris, and important to be clear with your audience on what they should expect when interacting with their medical provider and what doctors should be thinking about in this new age. Typically, patient data is fiercely protected through a law that goes by the acronym HIPAA, Health Insurance Portability and Accountability Act. And that protects the provision of health information. So you can't just willy-nilly give it out. You can't just, especially if no law is being violated. I'm not a lawyer. I'm not an expert necessarily in HIPAA, but I do know what's right versus what's wrong when it comes to patient data. And Chris, this was something that was relevant during the pandemic. Patient data is something that you can report in the setting of a public health crisis if there's a communicable disease that we're worried about, if there's concerns, say, about child abuse, if there's homicidal concerns, say, gun violence, knife violence, things that are reportable law enforcement. This is not the case in this case because when it comes to the care of those that are transgender, that's states guide that. And so there is no violation of state law in, say, the state of Pennsylvania in this case. And so the fact that they're asking for communications on medical care on Zoom notes is entirely inappropriate. It's incredibly chilling. It's not allowed to have a lot of downstream impacts on patient care and on provider wellness.
Jennifer, as Dr. Gupta says, he's not a lawyer, but you are. Can these subpoenas be enforced given a patient's right to privacy?
You know, these subpoenas are breathtakingly broad in terms of the private information that they are seeking, and there's not a legitimate basis to explore the kind of invasive information that they seek. So fortunately, you know, what we are seeing and what I would anticipate would be the recipients of those subpoenas to quash the scope of what's been requested. They're clearly designed to chill the provision of well-established medical care for a vulnerable population.
So what legal options would a doctor or would a patient have in a case like this?
Yeah, absolutely. So, you know, there's judicial oversight to restrict the kind of private information that's being sought, and particularly where on balance it doesn't provide any credible information. To the extent that what the federal government is looking for is information related to legitimate concerns, there's far narrower requests that could be made. Private patient information can be restricted, aggregated data about billing practices can be sought. That's the kind of general information that can be obtained by the federal government, but certainly federal courts can step in to restrict the scope of what's being requested by the administration.
Jonathan, what's the point here? Is it fear?
That is a key question. I think fear, I don't know if that is what they're up to, but it is certainly a byproduct. And I want to apologize to everyone if it sounds very windy, because it is very windy here. But fear, I think, is a byproduct. Also, for what purpose? What purpose is it for the administration to request such personal and private information? What are they going to use that for? And given all the things that we have seen the administration do to all sorts of populations, yeah, I don't even want to articulate what my biggest fear is. But this actually is a situation where it would be wonderful if Congress were acting like a co-equal branch of government and calling on the administration, hauling in the Secretary of HHS, hauling in the Attorney General or the folks at the Justice Department who are responsible for this, and have them explain why they are doing what they're doing, for what purpose, what will this information be used for, and then use all the power that they have as a co-equal branch of government to get the officials in the executive branch to stop doing what they're doing.
Dr. Gupta, there was a Midwestern doctor who had to turn over a work cell phone to supervisors after their hospital got a DOJ subpoena, and told the Washington Post this, quote, "Frankly, I'm looking over my shoulder driving home." I mean, we're already in a time when doctors could face prison time for performing abortions. Can medicine be practiced effectively and in accordance with the Hippocratic Oath if not medical but political considerations are at play?
No, it cannot. And this is the canary in the coal mine. You mentioned the provision of abortion care, even in settings of emergencies. And when the life of the mother, for example, is at risk. We've seen in cases like in Kansas where sometimes life-saving procedures are being withheld because doctors are worried about impacts from a litigation standpoint. And we're seeing this in the case of the Midwestern doctor. And I'll also say before long, with vaccine recommendations now potentially going off-label, say COVID vaccine and kids, an off-label recommendation from the American Academy of Pediatrics, concern now amongst provider groups is, Chris, what happens if, say, a pediatrician recommends an immunization, provides immunization for something that is not necessarily recommended from ACIP and the CDC? Could those providers be sued? And so articulating some of the fears here and where this could potentially go, again, this is the canary in the coal mine. And, where are we headed next? That's the concern.
So, Jonathan didn't want to say what his biggest fear was, but I wonder if you'll tell me what's your concern about where this might go next.
Yeah, I mean, this administration has been openly hostile towards transgender people, has taken steps to eliminate parents' ability to get the health care that their adolescents need. And this, deep fishing expedition clearly has an intended chilling effect on the provision of well-established medical care. So, yeah, I'm very concerned about the goal of this administration, which is to keep transgender adolescents, transgender adults potentially from getting the medical care that they need and from going after the doctors that follow the Hippocratic Oath in providing it.
Jonathan, the LGBTQ online magazine, Them, had some new research out this week from the Williams Institute, and it showed that there are about 2.8 million transgender and non-binary people in the U.S., but among them, 724,000 trans youth between 13 and 17 years old. If you're growing up as a trans kid right now and you're under a microscope, what impact does that have?
It's terrifying. Can we just keep in mind that we are talking about 13 to 17-year-olds? If you are not 13 to 17, you remember what it was like then. All the things you were going through, the things you were thinking about, identity issues of all kinds. And what you are looking for is care and comfort, people to nurture you and help guide you through those very tumultuous years for a whole host of reasons. And yet, if you're an LGBTQ youth, and particularly a trans youth, in the midst of all of that, you have the President of the United States and his administration, high officials in his administration, doing everything it seems possible to make your adolescence a living hell, and to do things to prevent you from, being in an environment where you can grow and become the full you. And that's what I think is among the many things that is so terrible about what's happening. Everyone likes to talk about trans youth and trans adults and trans athletes without talking about the individuals, the actual people for whom this is not a political game. This is their lives.
Jonathan Capehart, Jennifer Levi, Dr. Vin Gupta, thank you all. And you can catch more of Jonathan on his show The Weekend, Saturdays and Sundays, 7 a.m. Eastern, right here on MSNBC. And coming up, could the Menendez brothers walk free after decades behind bars? The high-profile parole hearings happening today and tomorrow.